We recommend annual dental exams for most horses to provide baseline preventative care and maintenance of their oral health. We perform sedated oral exams to identify any problems that may need to be addressed. Dr. Rice is starting her external exam, looking at the symmetry of the face and looking for any external abnormalities that may relate to dental disease. We assess the occlusion and the incisors prior to placing the speculum. In particular, we like to assess how the jaw slides from side to side. We check this before and after floating. The speculum we use is made out of aluminum, and it is light and comfortable for the horse to wear. We rinse the mouth with a dilute antiseptic to remove any feed material prior to our visual exam. Our intraoral exam incorporates 5 components, including external findings, occlusion, oral soft tissues, endodontic, and periodontal status. As you can see here, the mirror exam can be performed relatively quickly, but gives us a lot of great information on your horse's oral health. You'll notice how the horse's head is resting comfortably on a headstand. Adequate sedation means that we have a compliant patient for our exam. Here is an intraoral video showing what we are looking at with our dental mirror. We are looking at the upper cheek teeth here, looking carefully for any signs of tooth decay, fracture, or gum disease. You'll see that this horse has some sharp points with small abrasions visible in the cheek. These abrasions typically resolve after removal of the sharp enamel points. When we examine the left side of the mouth, you'll notice a small infundibular caries or cavity where there is feed trapping in the first cheek tooth. This is an issue that we will note in the horse's medical record and monitor. Again, you'll notice some sharp minor points and abrasions on the left side of this horse's mouth. The lower teeth have some mild signs of feed trapping between several teeth, which in this horse's case was early periodontal or gum disease. Early identification of problems such as these can be huge in maintaining oral comfort and preventing early tooth loss. The lower teeth tend to get sharp points along the aspect closest to the tongue. Again, you'll see here that this horse has several gaps with feed trapping in between several of the lower cheek teeth. Now we will demonstrate the occlusal adjustment, or dental float. We use a variety of motorized dental instruments to remove the sharp enamel points that form on the cheek teeth. Horses have teeth that continue to erupt over their lifetime, which causes them to sharpen over time as they chew and grind their food. By removing these sharp points, we can improve the soft tissue comfort of the mouth. Some horses may develop some imbalances in the height of some of their teeth, which we will also address through floating. You'll see here that we use water-cooled instruments so that the tooth is cooled as we are floating. This reduces the chance of causing thermal injury to the teeth. Our floats also have vacuum suction, which allows for exceptional visualization of the floating process, allowing us to be very precise in our occlusal adjustments. You can see here that we are using a different float that has an apple core shaped burr. We use this as a finishing float to create a nice rounded edge to the outer aspect of the teeth. This float has a very thin profile and is especially useful in small pony or miniature horse mouths. We provide dental care for tiny miniature horses that may weigh less than 100 pounds, up to the largest draft horses that may weigh over a ton. We generally recommend that horses receive an initial oral evaluation shortly after birth and then yearly exams after that. Most horses receive their first occlusal adjustment between 2 and 3 years of age. Horses lose their baby teeth between the ages of 2.5 and 4 years of age and generally do not have their full set of adult teeth until they reach the age of 5. When we float the lower cheek teeth, we can actually down-angle the head of our float, which allows us to visualize the teeth as we are using the instrument. You'll notice that the lower cheek teeth get sharp points along the aspect closest to the tongue. The lower jaw has a natural curvature towards the back of the mouth, which is part of their normal anatomy. Here is a before and after shot of this horse. You will notice the sharp points along the cheek that have been removed and the large ridge on the last tooth that has been reduced. Here is a picture of the lower cheek teeth before and after floating. Again, you'll notice the removal of the sharp points along the tongue, which is on the right side, as well as some of the ridges that were present on the chewing surface. At the end, we examine the incisors and check the occlusion again, including lateral excursion. Sometimes we need to make adjustments on the incisors, but this really depends on each individual horse.